Why is it so popular? Well, a lot of information out there about Pico lasers. A very good laser, something that was used for tattoo removal, but we can also extend the use of the Pico laser for pigmentation and for rejuvenation as well. It's good to note that it's a picosecond because picosecond means 1/trillionth of a second or 10 to the power of minus 12. So these are really ultra short pulses of the 1064 nanometer Nd:YAG laser. So given its potential to have a targeted approach, maximum damage on what we want to shatter, but minimal damage on the surrounding tissue, it's become really very popular. But is it really useful for everyone? So there are a few things that I'd like to discuss. Firstly, it's the type of pigmentation. It's effective for types of pigmentation like sunspots, freckles, and melasma. However, not all pigmentation responds in the same way. If you have a complex pigmentation issue like melasma, it tends to be very deep. And not only is it deep, it can be intertwined with other cell types in the deeper part of the dermis. Also means that one treatment might not be enough, and maybe the picosecond laser is not the only thing that we need to do when it comes to such complex pigmentation. Now, secondly, it's the severity of pigmentation as well. You've got freckles, a bit of sunspots, maybe some post-inflammatory hyperpigmentation that can be a bit more superficial. And these are a little bit more straightforward. But in the deeper pigmentation, where there's clusters of pigment in a part of melasma, it becomes a little bit more complex. You find that these deeply seated pigmentation can really require additional sessions of laser and also perhaps a combination of treatment as well. Next, we need to consider the skin tone and the type of skin. In Asia, a lot of us are Fitzpatrick type 3, 4, 5, so we are slightly darker skin tone. So it's important really that we need to make the assessment to remove what it's deemed not so ideal pigmentation, but also preserving the normal color of your skin. And for darker skin types, the margin is really a bit smaller. So this really requires a practitioner to be astute, to observe, and to make sure that the treatment is gentle but effective and not such that you're going to cause hypopigmentation. So ultimately, if the intensity of the laser is not adjusted properly, you can get some really unideal situations and outcomes, and that would really reduce the effectiveness of the overall treatment. So what then do we really need to do when we are doing a Pico laser?